Happy New Year, everyone. So glad to see everybody back. Carlin and I are excited to get this year going again. I think we're waiting on her still to hop on. I think what we're going to do today is we're going to start with an update from Alicia about the cancer plan and what's coming up from there and some of the things we're looking forward to. And then we're going to have Image Reborn give us some information about their program. So, Alicia, do you want to go ahead and start with the cancer plan?
Yeah, absolutely. Thank you so much, Krista. My name is Alicia. I'm the comp cancer specialist at CDPHE. Just some updates on the upcoming revision of the cancer plan. We are planning on releasing the 2026 to 2030 cancer plan the end of February, early March 2026. So really excited to get that out there. We're so grateful for your feedback from public comment and all of the wonderful ideas that you had. So we're excited to put that next 5-year plan together. And I also just wanted to congratulate Susan and Image Reborn for being an organizational highlight in the upcoming cancer plan. So, congratulations to you all. And then we are looking at potentially doing some webinars in September for the cancer plan and looking at a potential collaboration with the Pediatric AYA Task Force. And so more information to come once that is launched and once we can get the planning underway. And do you want me to turn it back over to you, Krista, or send it over to Susan?
No, I'm going to take it real quick and just let everybody know that our March meeting is going to be a follow-up webinar from our estate planning one that was earlier in the, or actually was last year. And it is going to be looking at estate planning through like a more serious illness lens. So what do we need to do specifically rather than just kind of the general that we did? And I think Ella was going to put a link to the plan or the webinar from last year into the chat. So if anyone hasn't seen that, there's some really great information both for anyone who is dealing with a serious illness and anyone who is not, because it's really important. But I think with that, Susan, I'm going to turn it over to you to introduce yourself. And I think Ella will manage the screen sharing if she hasn't already done so. And we really look forward to hearing about your program.
Great. Well, I'm really excited today. Both Darlene and I are able to attend. Darlene is coming to us from San Diego, and we have our interpreter here, Kathy. I'm going to go ahead and start sharing. We got a little slide deck for you, so let's get that going.
So yeah, it sounds like that's reasonable, and I can certainly let
All
Dr.
right.
Rona know that that's what she's thinking and what the plan is. And then,
Sounds like there's somebody else talking, perhaps. All right.
Want to just for now keep this
I want to make sure.
scheduled then?
I'm not sure where that. Okay, I think we got all that taken care of. All right, we ready to roll? Are you able to see my slide deck? Yeah, fabulous. All right. Well, we are so excited to be here. Image Reborn is just thrilled as a relatively new Colorado organization to be able to share with you not only what we do in general, but also how we are partnering and providing services to the deaf community. So we have got a lot to share. Let me move on to the next slide. So it all started with a man who is a doctor, Dr. Renato Saltz, who is the founder. He is a plastic surgeon out in Salt Lake City. And about 28 years ago, he had seen so many women coming through his doors, getting reconstruction, and then not feeling like they had really been able to get the psychosocial support that they needed. So it was his brainchild to say, let's provide free retreats for women who have breast cancer, where they can have not only a chance to meet with one another, but they can have access to things like self-care, such as massage. And we'll get into some of the things that we provide, but massage and Reiki and yoga. And what's really essential for these women is to have that time to come together and bond. And I'm a breast cancer survivor, as is Darlene. And so I went to one of these retreats back in, I think it was 2018. And his vision has been expanding and expanding and expanding over the years. The mission is that these are no cost retreats, so there's no cost to the women that come. And the idea is that they can have a richer life and they can also bridge that gap between the medical care and then the psychosocial needs that they have in a way that is actually enduring, we have found with all of the metrics that we do with our programs. So that was his vision oh so many years ago, and it just continues to grow. So we have several different, our flagship product is the retreat. And so it's either the Rest and Renew, which is a little more low key, or it's active renewal. And out here in Colorado, we just do active renewals because we're all about like moving and grooving and all that stuff. So the idea though is that these women will come, we have this phrase, we don't want you to lift a finger. And we really mean that because many of the women will come and they will just feel like, oh, I got to help. I got to clear my plates. And do you want me to help set up those yoga mats? And is there anything I can do to just sweep? No. And we say, this is for you. You may be used to all that, but that is not what you're here for. We want you to be pampered. And we do. The last thing that you see on this slide is just a nod to the adventure retreat that we have for alumni, where they are out rock climbing and kayaking and doing all kinds of fun stuff. Once a season, we will do one of our adventure retreats. So what we're doing when we're there, they come in, these women, they don't know each other in many cases. They dive into lots of really wellness-based opportunities. We have excellent food. We say it's chef inspired. Rodizio Grill is a huge supporter of us, and they cater in one of our meals for our women, and they also support us in terms of lodging. But we provide a cancer exercise specialist, which has been wildly appreciated by our women, who many of them are needing to do modified exercises with a balloon in a circular group of chairs. And then there's other women that can run. And so our cancer exercise specialist, Terry, is amazing with adapting. And sometimes we'll have facials. We always have meditation, yoga. Sometimes we'll have Reiki, massage, hiking, walking, and just time to spend time together. It sounds like a pretty packed schedule, but actually, we really do make it, well, the responses we've got from women is we make it just right. They can do a little more if they want to. They can dial it back and have a rest if they want to. The idea is to serve anywhere between, in our case, most often it's 10 to 12 women in a retreat because we've been very fortunate with our partnership with Rodizio and Carol Kresge up in the mountains where we have these beautiful, we call them mountain mansions because they are. And so almost every woman has her own room and bathroom, which is wonderful. So we find that women really benefit from this restoration opportunity. But beyond retreats, we do other things. There's alumni involvement. You'll see something there that says Alumni Army. It's basically our alumni group. And that's something we're going to grow this year now that we're in Colorado, because we came to Colorado after myself and several other women who had come from Colorado, and we went out to Salt Lake, and we said, why don't we do these in Colorado? And Image Reborn is very forward thinking, and they said, why not? So we started in 2019 out here in Colorado. And so we are now growing because we've been doing, I think we're at 17 retreats we've done so far in the last handful of years. Had to take a year off for COVID. But this alumni group is growing and growing and growing now here in Colorado. There are programs oftentimes offered to Image Reborn past participants or possibly future participants or people who just want to get a chance to do a grief and gratitude circle or do a yoga practice online. And so, you might have 8 or 10 people that log in on a Wednesday night for an hour and do some of these things. We've got an upcoming winter retreat. So women are going to be doing this on Zoom over, I think it's a 7-night period over a couple of weeks. We'll be providing interpreters for the first time this year. So we're actually going to have, we think, a number of members of the deaf community joining us remotely from all over and also from Colorado, of course. There's a big highlight of our spring called the Spring Wellness Conference. It's also known as the Sex and Intimacy Conference, which was how it was originally branded. And some people were like, I don't know, what is that about? But women who have breast cancer have real needs in terms of the bodily changes that they go through, how it impacts them. And so this has been wildly um, appreciated by many women. This year it will be not only in person in Salt Lake, but made available in Zoom so that people all over the country are able to access something that's unique like this. And we bring in experts in the field. We're bringing in oncologists. We're bringing in folks that serve pelvic floor specialists, wellness professionals, and just really dialing in on a day of wellness for women. So it's more than just the retreats. It really is. We had 34 retreats total across the nation last year. Colorado had 4 of those, and we're growing. The specialty groups that we serve are stage 4 cancer patients. We also have people who are Hispanic, and those are done in just Spanish. Young Survivors, of course, is its own unique group. And of course, our flagship program that we love and began back in 2023 is to serve women who are deaf and hard of hearing and who sign. The entire retreat, as Darlene will explain, is done in ASL. And we serve now Utah, of course, Colorado. We were second to the plate. Now Texas, Florida, Puerto Rico, and coming soon this year will be California. So growing, 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 and we're really excited about ways that we plan to grow. So we've got a Colorado group that started pretty small. Now we have 5 general retreat facilitators, and you see a few of us sprinkled in there with some volunteers as well. And then, of course, we've got this growing deaf team that you're going to learn more about. All right, I'm going to turn it over now to Darlene.
Thank you. Sorry, the interpreter needed to get her mic on. Thank you. Okay, so this all began with one step. Gretchen DeWald and Susan Fultonson established the first deaf retreat in 2023. Give you a little history about that. They were involved with Image Reborn, and they're thinking, where are the deaf women who have also experienced breast cancer? And so in 2023, they established this first deaf retreat, and I'm very grateful. So this was their vision to try to get this up and running. They both were leaders, facilitators of that first retreat, and then they started to train deaf individuals who were interested to become the facilitators. And from that, a lot more has happened. So
Yes,
in
definitely.
this,
Can you see it okay?
okay. So here is a picture of 4 deaf women who have all been to the retreats as participants. Starting on the right, we have Monica, who was from Alaska, actually, and LJ is next. They're in the black shirt from Canada. And then Lamari is there in the pink shirt. She's from Maryland. And then the 4th person there is me, and I'm from California. Pardon me. And so really we serve people, deaf individuals all over Colorado as well as outside of, and even including as far as Canada and Alaska. So Monica went to the 2023 retreat and developed an interest in becoming a facilitator. And so she then at the 2024 retreat was a facilitator in training, and was looking forward to having Lamari join us for that event. And Lamari will also be joining us for the 2026 event as a facilitator in training. So unfortunately, Monica passed away here shortly after Thanksgiving this year. But the 3 of us have rolled up our sleeves, and we're continuing to move forward as the deaf facilitator core.
Lucia and Darlene will be the facilitator.
Lucia, thank you. Okay, so before we dive into all of this, I'd like to explain a little bit more about the benefits that deaf women receive when they participate in these retreats. We're confronted with a lot of barriers, and one of the first things that we have noticed is that there's a poor health literacy throughout the deaf community. That the health system is so complicated, and there's so many large terminology and so much to read and learn. And so if that information is presented in ASL, it's better, but without that, it's overwhelming, it's unclear, it's complicated, and we don't understand all of the medical terms and what all the options are, or behind what's behind all those terms. Access to medical providers is another barrier. There are various medical centers, hospitals, things like that. Unfortunately, they do not all provide interpreters. They're not aware of the need for sign language interpreters. And so they tend to pull out a pad and paper and write notes back and forth, or have captions on things. And this is something that, like even the Hispanic community, they want to be able to speak in their native language. And so does the deaf community. We want to have information provided in ASL so that we can understand that in our first language.
Mhm.
So providers would often say, "Oh, well, how do I pay for the interpreter?" Well, it's a law through the American with Disabilities Act. Medical providers, hospitals, they're all required legally to provide interpreting services. And so I'd like to encourage them to bring someone in to have that interpreting services provided. So oftentimes they'll bring in a family member. The deaf patient will bring in a family member with them, or someone they trust, to help with that communication. But it's essential to have that in sign language, because ASL is its own language, and deaf individuals are very visually based, very visual individuals, and so that is why that's so important to have those resources available in sign language. Um, Other things, oftentimes some of those providers have never even met a deaf individual. They have no idea about the cultural or linguistic needs and of the deaf individuals, and how much that can assist in their treatment.
Incorporating culture.
And so we need to also incorporate culture, the deaf culture, with the treatment. So there's a lot of rules and things that we need to consider, but those are four of the main barriers that deaf individuals have experienced. In this schematic, we have the deaf patient in the middle, and the deaf patient's core team is in that dark blue circle. So now when there's a hearing person who's a patient, all the core team is also hearing. And so there's no limitation there to communication. But then we also have the non-core team in the outer circle, and the hearing patient would have access to all of those things. The deaf patient, their struggles because they do not have full access to all of that. And the core team does not have enough knowledge about what deaf individuals need. And so the deaf person is left more isolated. They're not sure how to make all of these decisions about their treatment. What are the options that are available to them? And then you can also see on the very outside of the schematic, all these little red circles. There's that's really part of the deaf community. We have where they would get information from advocates and support groups and things like that. That is not included. They're not connected with that core team, and so those things get missed. So, for example, Susan and Gretchen, and as you know, Kathy is also the interpreter here today. But Susan and Gretchen are both interpreters, and they were getting that started. All of this retreat started for Image Reborn for deaf individuals because they are cancer survivors themselves. And they noticed that we just did not have anything to bridge that gap for the deaf community, from that medical services to the other psychological needs that people have, and cultural needs, specifically linguistic needs of the deaf community. So if those two didn't have this vision, and this was never set up, we would be in a horrible state. So I am extremely grateful to Susan and Gretchen for this vision. On the next slide, you're going to see a little bit about how Image Reborn has affected some of our deaf individuals. I'm going to share a few stories and some of the things that they say have benefited them. So first of all, my own personal story. About 25 years ago, I was working with the University of California, San Diego uh, Health Center. I was a community health instructor and coordinator, in instructing the deaf community about how to recognize breast cancer, so some of the early signs, in order to have that early diagnosis, and some of the other things that come along with having breast cancer. What are some of those resources that are available, those kinds of things. And then my life took a change, and I started focusing on my family. And then in 2023, I was pulled back into that circle because I was diagnosed with breast cancer myself, and that was quite a shock. So, from 25 years ago, as a community health instructor, I was familiar with cancer and the whole system and how you access and navigate that, but I was doing that alone. And as most individuals are doing that alone, I knew how to ask the proper questions. I knew the system. I knew how to get an advocate, that kind of thing. So that was very helpful, but I still felt very alone as I was going through this. Then I attended the Image Reborn retreat, and oh my gosh, I found my tribe. I connected with these women, and we all just had all the shared values, and we hungered for the ability to socialize and share our experiences, and it just, oh, it gives me goosebumps as I think about it. But so I thank you so much for that, and I cherish that experience. But another story that I want to share is a woman who came to the 2024 retreat with me. We were chatting, and I was just touched by her story. She lived in Montana, and very isolated up there, not a lot of resources. The providers did not, or actually refused to provide interpreting services for her. She did not have any advocates, struggled back and forth with the note writing and trying to understand what all her options were with her treatment, and even what kind of cancer she had, or what stage she was at. She attended the retreat and started gaining all of this information in ASL, and went, oh, wow, my eyes are open. I wish I'd have known this before. I wish I'd have known about all of these other treatment options and things that were happening before. She was just grieving because of the missed information that has really had affected her life. She didn't know, like I said, what stage cancer she was in, or even what kind of breast cancer she had. She didn't understand any of that because there was no interpreter provided. And trying to read all of these large medical terms, she was just very frustrated. So, and that's pretty common, unfortunately, for many deaf women who experience breast cancer. And unfortunately, 10 months after she attended our 2024 retreat, she did pass away. She had stage 4 metastatic breast cancer. In 2025, we had another beautiful young woman that I was able to chat with. Um, and she was diagnosed with breast cancer very early, like around age 27, 28. And again, having difficulty navigating through the whole medical system and all of her treatment options, and felt like she really could not understand fully what was going on and what decisions she needed to make, what was involved with the treatment plan. So finally, the provider suggested she have a double mastectomy. And her dream was to get married, to have children, have babies, um, and be able to breastfeed those babies. But um, her dream could never happen now, since she went ahead and had that double mastectomy, not understanding that she had other options. So we would like to have, if the interpreter were there and present for this young lady, she could have asked more questions and had more access to more information and finding out what those other options are, instead of just having a double mastectomy from the beginning. When she was met with another provider later on, she said, well, you did have other options. Oh my gosh, what a heartbreak. It was too late at that point when she learned about those other options. So now her dream was gone. So again, these four major barriers that deaf women who experience breast cancer face, and from their core medical team that needs to just be much more aware and sensitive to the deaf needs. So Image Reborn has been a positive experience, I believe, for everyone who has attended. Um, the 2023 conference had 10 individuals who joined, and then in 2024 we had 11, and in 2025 we had 12. So it continues to grow. And we've had women tell us all about what they feel is beneficial um, for from the retreat. So I'm going to go over a few of those benefits here real quick. One of those things, of course, is self-care, and both during and after treatment, and learning how to take care of yourself. And the retreat focuses on that, um, and it really focuses on the connections that we make within the community. So we are not isolated and going through this alone. And it incorporates the culture and the communication, because everything is done in sign. And also, we really focus on the empowerment of deaf individuals, and their healing. So next slide there, please. Thank you. Okay, so here's the same picture of these same four deaf ladies from the retreat. All four of us would still, we're connected after the retreats, texting each other, sharing happy moments, sad moments, funny moments, and just our struggles and keeping connected. This is what my group of what we call our Pink Sisters Forever. So unfortunately, there's just the three of us left, but we do really value and cherish the time that we've had to develop these relationships. And after I came home from the first retreat, my husband said, "Oh my gosh, you are just glowing. What happened there? You are so much more confident." I was thriving. And so I explained to him about the retreat and the advocacy, the support, the relationships that were built there, and just how much more that has benefited me, not only as a woman, but as a cancer survivor. And so each person who has come to the retreat, we ask them to come up with a word or phrase that is what their takeaway or their belief of what the retreat has provided for them. So I have a short video to show you about that. One love. Oh, my turn. Happy memories. Awesome. Positive. Above and beyond. 2 thumbs up. Wow. Empowerment. Uplifting. Inspiring. So that pretty much wraps up my presentation. I would like to open the floor for any questions you may have for us.
Thank you so much.
I want to look here in the chat here real quick too and see if there's anything in there.
I think that's amazing what you guys are doing for breast cancer survivors in general, but then to specifically focus on the needs of a population that I think is largely, as you have said, ignored by the medical system. And what a great opportunity for us to learn about that. And I'm thinking about all the things that we're not doing right now that we have not thought about for the deaf community, even on our task force. So I thank you for bringing that to our attention. Um, I did have one question about the spring wellness conference and whether or not that was open to cancer survivors that are not specifically breast cancer survivors. Because I think it has value for most of our female cancer survivors.
Krista, that's a great question. I'm not sure. I can check that out though, and I'd be happy to reach out to you and let you know if there is. I mean, generally, Image Reborn focuses on breast cancer, but let me find out.
Yeah, especially with the virtual piece of it, you can include a lot of people without necessarily, having to take up too much space. So,
Absolutely. Yeah,
and we
I'll
would
check that out.
and we would be happy to share that. We send out a monthly newsletter with updates about things that are going on, and we can share it even if it's disease specific. That's not a problem. But if it's open to others, we want to make sure to include that information. And I think we did have a couple of questions pop up in the chat. Is it too late to register patients for the spring retreat?
I actually don't think it's gone officially live yet. So they better get on it because it's mid-March. So we do need to get the word out. But no, it won't be too late to register. And we'll have that posted on imagerebornfoundation.org. That is our very long handle there on the web, but imagerebornfoundation.org will be posting all that information about that particular event. And our registration is now open for registrants to come to the retreats. And some women from Colorado can choose to go to Salt Lake if they prefer. But of course, we like our Colorado ladies to come see us up in the mountains of Dillon and Breckenridge. But we have open registration now.
And if you want to send us a little something, Susan, we can put that into our next timely task force update as well. Carlin keeps that really up to date.
Will do.
And then I think there was a good question here that was more general, less specific to the cancer population in general, but more towards the deaf community. And what are the requirements, if you guys know about small nonprofits meeting the ADA requirements, just given often the limited budget that many of them face?
Yeah, this is Darlene. I'll answer that. Yeah. Um, that's a constant issue that we face, and trying to find enough funding, and there are resources, um, and they should have a budget for disability services such as interpreters if they can, and blind individuals would need to have braille, that kind of thing, um, and to provide that access to all individuals with disabilities. But there are some people who have low vision even and need larger print, that kind of thing. So it's just thinking a little bit more outside of the box, if you will, and not the norm. So to try to be as inclusive as possible for everyone. And so, yes, of course, start that with their budget planning at the very beginning, if they can, to keep some of those things in mind and have a little reserve for some of those requests, those accessibility requests. That's one suggestion.
There is in the rural areas of Colorado, there is actually funding available to provide interpreters outside of the Denver metro area and down the Front Range. So it's the I believe Rural Interpreter something project RISP, and it's through the Colorado Division for they used to call it Colorado Commission for the Deaf and Hard of Hearing, Deaf Blind, and now it's a division, not a commission. But that is the organization that can provide rural accessibility at no cost to doctors' offices. Well, doctors' offices, they encourage them to pay for that, but if it's a very small kind of thing, then that can also be available for a number of different kinds of events. if it's in the rural area. We just don't have that same kind of nonprofit support coverage more on the Denver front line. But yeah, it can be pretty challenging.
I saw another question about support from the retreat, something along those lines. Susan, did you want to answer that one?
We're really growing our retreats. In fact, or our sponsorship. I mentioned Rodizio Grill being a big supporter. Texas Roadhouse is a big supporter. And Clover Mountain Homes up in Breckenridge and Dillon, we partnership with their owner, Carol Kresge, and bring all the housing together. We recently also received and are just receiving in 2 weeks a $12,000 grant, which is helpful for us because our retreats can run about a $10,000 a pop, and we're doing 4 of them. So I would have to say we are in our growth stages of trying to secure more Colorado-based funding. We've had a great start with some of these partnerships, and we're always looking for more because we're really growing within the state and hope to add. We'd like to add a stage 4 retreat. We'd also like to see about building another deaf retreat, perhaps in Colorado, perhaps outside of Colorado. So right now, those are our key players, but we're in that growth process right now.
And I want to make sure that you're all seeing the note from Katie in the chat. Her organization offers hikes and walks to cancer patients and survivors, and so it looks like she has shared her number to maybe connect and to do some collaboration. Let's see, there are other questions. If there's anybody who has a question that hasn't been mentioned, please just unmute yourself and speak up.
Hi, this is Carlin. I think funding has been such a challenge for so many of these nonprofits, and in 2026, I think it will continue to be a challenge. Is there any sort of desire to maybe have the coalition lead a working group or a planning session where maybe some of the nonprofits could come together and share best practices? Because I mean, part of our focus in our task force is to connect healthcare professionals and experts with some of these amazing resources. And it just seems like maybe that's something our task force could facilitate.
I'm a big believer in abundance as opposed to a scarcity mindset. So absolutely, I would be happy to be on a task force that binds us together and helps us just to, sh iron sharpens iron. And I think it would be a great idea because we can probably collectively get more traction than if we're all working in our own little silos.
Said agreed, says Darlene.
Hi, hello. My name is Janice, and I work for a gynecologic cancer organization that supports women with all types of gyn cancer. And I have become aware that many of the breast cancer support organizations have opened their services to women with gyn cancer because of the connection with the BRCA gene. And so I wondered if your organization has considered opening up your services and your support to women with gyn cancers.
We actually have definitely begun those discussions. Dr. Saltz's vision was originally breast cancer, and more and more and more. We're having women approach us and say, I've got the wrong kind of cancer. I can't go to your retreat. And it's like, no, no. So we absolutely have started that discussion. We don't have anything in place at this exact time, but absolutely, because the two of them are oftentimes kind of hand in hand. So stay tuned on that because it's become more and more of a request.
Oh, good. Thank you.
Well, thank you again so much. And, we'll invite you, Susan and Darlene, to join our task force. I think that we may need to talk with our organization to make sure that we're offering interpreter services. I know we often will have Spanish language interpreters for some of our groups where we know we're going to have a larger population, but I will admit that we have been remiss about thinking about the deaf community, and I will extend an apology on that behalf. So we've got some people sharing some contact information in the chat, and I think Carlin will talk about what next steps can be to connect some of our groups, maybe outside of this task force, but some of the nonprofits and on another level. And we've got really great support from Ella and Alicia from Trailhead and from the CDPHE. So we'll continue that conversation. Ella, Alicia, Carlin, is there anything else that we would like to cover before we wrap up for today?
I don't have anything else. I hope you all stay warm on this snowy day.
I think it's an exciting time with the cancer plan in February and just everybody taking time to come together. I did want to do a shout out to Dr. Wan, who had her work published in September, and she used this task force to recruit. So there's so much that we can do that's low-hanging fruit and to connect with people. So congratulations on that, and thanks for all that you have done with rural palliative care. Happy New Year.
Yeah, well, thank you. This group's really helped me as well as morally, as well as really logistic support, reaching out to rural healthcare professionals. We all know people in rural, serving rural population, how busy they are, multiple hats. Myself actually has been actively in the space as well. I worked with living by volunteering for the retreats. I was in Breckenridge. But this background's in Golden. So yeah, happy to continuously be active and supportive in this group, and also myself as a certified yoga instructor, mindfulness meditation guide, and happy to insert myself if there's a need.
Well, and that's what this group is for, to connect people that are doing great work for people in Colorado and outside of Colorado that are dealing with cancer. So we really appreciate everybody, and we wish you a happy new year. And I know, Darlene, you're probably nice and warm. Actually, you might be wet in San Diego. I don't know what your weather's doing now, but it's cold and snowy here.
Yeah, it's cold and snowy. I put a message over there, sharing a group in Oregon doing psychedelic retreat for cancer patients and other life-limiting illness, and that's an idea as well.
Thank you. Okay, everyone. Enjoy the rest of your new year. We'll see you in March for our conversation about estate planning. Like I said, valuable, not for far beyond those in the cancer community.
Very nice meeting. Thank you so much.
Thank you, everybody.
Appreciate being part of it.
Thanks, everyone. Happy New Year.
Happy New Year.
Thank
Bye-bye.
you so much for
Bye-bye.
including us. Thank you.
Thank you very much for presenting. That was great.